Immunotherapy has transformed melanoma care. It has shifted outcomes, opened new possibilities, and given thousands of people time and hope that didn't even exist a decade ago. But with that hope comes something quieter and more important for safety: understanding the serious side effects that can appear, knowing exactly when to reach out for help. These serious effects are not common, but on the rare occasions that they do occur, they matter because catching them early makes all the difference. And it's useful to contrast them with what we covered in the first part of this dual video. The three most common everyday side effects most patients experience and notice when they're on immunotherapy, which are the fatigue, skin reactions, and thyroid changes. And separately, there's the episode I made on melanoma's new era of hope, where we talked about how immunotherapy works in the first place. All these form one floor of understanding: the everyday effects, the hope, and now the serious but uncommon ones that keep you safe when recognized early. In today's video, I want to talk to you slowly through these three serious side effects of melanoma immunotherapy. These are colitis, hepatitis, and pneumonitis. These are the ones every patient should be aware of, not to frighten you, but to protect you. And before we go further, you can turn on the captions if you like. The key terms are highlighted clearly on the screen. Let's begin with colitis, which is simply the inflammation of the bowel. The bowel is full of immune cells, constantly monitoring what we eat and what comes through the gut. So when the immunotherapy activates the immune system, those cells can sometimes react too strongly. So the bowel lining becomes irritated and inflamed. The bowel moves faster than normal and water absorption drops. What people experience at first can be easily dismissed. A few extra trips to the toilet, loose stool that doesn't settle, a bit of cramping, or a sense of urgency to go. But when you're on immunotherapy, even mild diarrhea deserves attention. These changes can escalate quickly if they are ignored. Blood or mucus in the stool is never something to wait on during treatment. The reassuring part is that colitis responds very well when it's picked up early. Treatment usually begins with pausing the immunotherapy and using steroids to calm the inflammation. If needed, a more targeted medication can settle things very quickly. And once the bowel heals, many people will continue on the immunotherapy safely. The key is not ignoring or pushing through symptoms. Early recognition keeps you safe. The second serious side effect is hepatitis, inflammation of the liver. This one behaves differently because it often has no early warning symptoms at all. People feel completely normal. The first clues appear in the blood test that is run regularly during treatment. That's why regular monitoring is not just routine but essential. When hepatitis does cause symptoms, they tend to be vague and non-specific. A sense of fullness under the ribs, nausea, fatigue. In more advanced cases, yellowing of the eyes or darker urine. But most people never reach that stage because the blood tests pick up these changes early. And just as with colitis, steroids calm it effectively. Most people recover from it fully and continue with the immunotherapy. Now let's talk about pneumonitis, inflammation of the lung tissue. It affects the tiny air sacs and the thin membranes that exchange oxygen. This is the one I want you to recognize the earliest, because the lungs are delicate and the earliest signs do not always feel serious. A dry cough that lingers, breathlessness climbing stairs that didn't bother you the month earlier, a light chest tightness perhaps, sometimes a low-grade fever. These symptoms are easy to mistake for a cold or a mild chest infection. But on immunotherapy, they should be reviewed early because pneumonitis can progress quickly if untreated. When caught early, pneumonitis is usually mild. A temporary pause in treatment and a short course of steroids often settles it. More serious cases sometimes need hospital care and oxygen, but the good news is that most people do improve with treatment and many do resume immunotherapy soon after. When you step back and look at these three serious side effects together, there is a clear pattern. Colitis, the bowel; hepatitis, the liver; pneumonitis, the lungs. But the mechanism behind all three is the same. Immunotherapy activates your immune system to recognize and attack melanoma cells. Most of the time it stays focused within its purpose. Occasionally it becomes over-enthusiastic and drifts into these healthy organs. These events don't signal that immunotherapy is failing. They are signals that your immune system is powerful and needs gentle guiding. The most important thing to remember is that these serious side effects are not common. Most people never experience them. But for the small number who do, early recognition is the key that makes them far more manageable. You simply need to notice what feels new, what feels persistent, and what seems unusual for you. A cough that doesn't fit your usual pattern, diarrhea that lasts longer than a day, fatigue that doesn't make sense, blood tests that shift between appointments. These are signals, not alarms, and they deserve attention. One of the biggest fears patients have is that reporting symptoms will automatically mean their treatment stops. But that is not always the case. In fact, reporting side effects early is what keeps you on treatment safely. Silence is the real danger. Early communication is the real protection. Your clinical team is there to support you through every step of the immunotherapy. Immunotherapy has changed the outlook for melanoma in remarkable ways, but knowledge, awareness, and early reporting keep you on the safest possible path. If you found this episode helpful, you might want to go back to the first part of this duel, where we talked about the three most common side effects of immunotherapy. You may also want to share with your family or friends who are going through the process at the moment. And if you want a wider view of why immunotherapy changed melanoma so profoundly, watch the several episodes I made earlier on melanoma and the new era of hope. Together, these videos will give you a fuller, steadier picture of what to expect and what to watch for. Thank you for joining me for this No Hype Health Talk. Stay observant, stay confident, and remember that awareness is one of your strongest companions on this journey.